How can I help you? How can I help you? Please fill out these forms. Please fill out these forms. What's your name? What's your name? Can you spell that for me? Can you spell that for me? Do you have any allergies? Do you have any allergies? When was your last meal? When was your last meal? What brings you here today? What brings you here today? Have you been here before? Have you been here before? What medications are you currently taking? What medications are you currently taking? How would you rate your pain on a scale of 1 to 10? How would you rate your pain on a scale of 1 to 10? Do you have a primary care physician? Do you have a primary care physician? Are you experiencing any discomfort? Are you experiencing any discomfort? Let's take your temperature. Let's take your temperature. Can you breathe normally? Can you breathe normally? Please lie down on the examination table. Please lie down on the examination table. I'm going to check your blood pressure. I'm going to check your blood pressure. Have you had any recent surgeries? Have you had any recent surgeries? Do you smoke or drink alcohol? Do you smoke or drink alcohol? Are you pregnant? Are you pregnant? Do you have any medical conditions? Do you have any medical conditions? Please remove your clothing and put on this gown. Please remove your clothing and put on this gown. Can you wiggle your fingers and toes? Can you wiggle your fingers and toes? I need to draw some blood for tests. I need to draw some blood for tests. Here's a tissue for your runny nose. Here's a tissue for your runny nose. Are you feeling dizzy or lightheaded? Are you feeling dizzy or lightheaded? Let's get you some water to drink. Let's get you some water to drink. Are you able to swallow? Are you able to swallow? How long have you been feeling this way? How long have you been feeling this way? Can you describe your symptoms to me? Can you describe your symptoms to me? Do you have a fever? Do you have a fever? Is there anyone we should contact for you? Is there anyone we should contact for you? I'm going to take a look at your wound. I'm going to take a look at your wound. Do you have insurance? Do you have insurance? Please sign this consent form. Please sign this consent form. Here are your test results. Here are your test results. You need to stay hydrated. You need to stay hydrated. It's important to get plenty of rest. It's important to get plenty of rest. You may feel some discomfort after the procedure. You may feel some discomfort after the procedure. You should avoid strenuous activity for a few days. You should avoid strenuous activity for a few days. Let me explain the treatment plan to you. Let me explain the treatment plan to you. It's important to follow up with your doctor. It's important to follow up with your doctor. You'll need to take these medications as prescribed. You'll need to take these medications as prescribed. Here's a prescription for your medication. Here's a prescription for your medication. Please take these pills with food. Please take these pills with food. Do you have any questions about your diagnosis? Do you have any questions about your diagnosis? How are you feeling emotionally? How are you feeling emotionally? Are you able to walk without assistance? Are you able to walk without assistance? Let's get you into a wheelchair. Let's get you into a wheelchair. I'll help you to the restroom. I'll help you to the restroom. Please use the call button if you need assistance. Please use the call button if you need assistance. Can you move your arm/leg for me? Can you move your arm/leg for me? Try to take deep breaths. Try to take deep breaths. I'll adjust your bed for comfort. I'll adjust your bed for comfort. You may experience some bruising at the injection site. You may experience some bruising at the injection site. It's important to keep the wound clean and dry. It's important to keep the wound clean and dry. Do you have any dietary restrictions? Do you have any dietary restrictions? Let's go over your discharge instructions. Let's go over your discharge instructions. Do you need a refill on your prescription? Do you need a refill on your prescription? Can you rate your pain again for me? Can you rate your pain again for me? You'll need to schedule a follow-up appointment. You'll need to schedule a follow-up appointment. Remember to take it easy for a few days. Remember to take it easy for a few days. You should avoid alcohol while taking this medication. You should avoid alcohol while taking this medication. Are you feeling nauseous or vomiting? Are you feeling nauseous or vomiting? Please use hand sanitizer before leaving the room. Please use hand sanitizer before leaving the room. Can you wiggle your toes for me? Can you wiggle your toes for me? How's your appetite? How's your appetite? Are you able to get comfortable in bed? Are you able to get comfortable in bed? Let's elevate your legs to reduce swelling. Let's elevate your legs to reduce swelling. I'll bring you some blankets to keep warm. I'll bring you some blankets to keep warm. Do you have a support system at home? Do you have a support system at home? You may feel some pressure during the procedure. You may feel some pressure during the procedure. Try to relax and take deep breaths. Try to relax and take deep breaths. Here's a list of exercises for you to do at home. Here's a list of exercises for you to do at home. You'll need to come back for a follow-up appointment in a week. You'll need to come back for a follow-up appointment in a week. It's normal to feel tired after surgery. It's normal to feel tired after surgery. Make sure to drink plenty of fluids. Make sure to drink plenty of fluids. You should avoid caffeine for now. You should avoid caffeine for now. Let's check your oxygen levels. Let's check your oxygen levels. Do you need assistance with bathing? Do you need assistance with bathing? I'll bring you a fresh gown and towels. I'll bring you a fresh gown and towels. Please let me know if you're feeling any discomfort. Please let me know if you're feeling any discomfort. Are you able to sleep at night? Are you able to sleep at night? Let's adjust your pillows for better support. Let's adjust your pillows for better support. You may experience some itching as the wound heals. You may experience some itching as the wound heals. Try not to scratch the area. Try not to scratch the area. Here's a heating pad to help with your pain. Here's a heating pad to help with your pain. Do you have any trouble hearing or seeing? Do you have any trouble hearing or seeing? You should avoid spicy foods for now. You should avoid spicy foods for now. Let's take a walk around the hallway. Let's take a walk around the hallway. Are you feeling more alert now? Are you feeling more alert now? Do you have any numbness or tingling? Do you have any numbness or tingling? You should avoid heavy lifting for a while. You should avoid heavy lifting for a while. Can you wiggle your ears for me? Can you wiggle your ears for me? Let's check your blood sugar levels. Let's check your blood sugar levels. Do you need assistance with dressing? Do you need assistance with dressing? Please use the handrails when walking. Please use the handrails when walking. Let's make sure your 4 is functioning properly. Let's make sure your 4 is functioning properly. Are you feeling any shortness of breath? Are you feeling any shortness of breath? I'll bring you some ice chips to suck on. I'll bring you some ice chips to suck on. Remember to take deep breaths and stay calm. Remember to take deep breaths and stay calm.